Welcome back to Ophthalmology for Undergraduates and Postgraduate Beginners. All the structures to be examined by an undergraduate we have completed with the previous video. But we are going to talk about certain other examinations which are very important for a postgraduate student and also will be useful for an undergraduate student to make a proper diagnosis. Today we will talk about field testing. Field testing is how much of area our eye can visualize. That is called as field testing. Field testing can be done in two ways using a perimeter. Perimeter is an equipment used for testing the fields, or we can do field testing without using a perimeter. So when you are using a perimeter, the following things can be used for testing the fields. One is the Gerard screen for testing the central field of vision. We can use a Goldman perimeter, which is a gold standard those days for checking the field of vision. And nowadays we have this automated perimeter which is practiced everywhere and it gives accurate values. We are not going to talk about this part here. We are going to talk about mainly this part where we don't use any perimeters, but still we can find out what is the field problem in the patient grossly, and sometimes we can come to a proper diagnosis. What are all the tests that are being done to test the fields without using a perimeter? One is the projection of rays. Second is the confrontation test. Let us see them in detail. Let us first discuss about the projection of rays. Projection of rays is usually done in an eye where the visual acuity is only hand movements, or it is only perception of light, or there is no perception of light. If the visual acuity is better than hand movements, usually projection of rays is not being done. We can go for confrontation testing. Now let me describe how to do the projection of rays testing. One eye of the patient has to be closed and you have to put the torchlight into the patient's eye from 4 directions. 4 directions means it is from upper lateral into the eye, lower lateral into the eye, lower nasal into the eye, and upper nasal into the eye. This way you show the light into the patient's eye and ask the patient to point his fingers towards the source of light. If the patient points his fingers correctly in each direction, then his retina is said to be functioning normally all around. That is what we say. This is a quantitative test. It is not a qualitative test. This will just say all the portions of the retina are functioning or not. Let us now see how to do a confrontation testing. Confrontation testing is usually done when the visual acuity is at least 1/60, or it should be more than halfway 60 to the minimum. The examiner and the patient has to sit in the opposite directions facing each other. If you want to test the right eye of the patient, you should ask the patient to close his left eye with his own hands. The examiner who is sitting facing the patient will close his right eye and he will keep the left eye open, and this left eye will look into the patient's right eye on the opposite side. Next, what you should do is, you should show fingers on the inferior quadrant on the outside and ask the patient to say how many fingers are shown. You should make sure the examiner himself is able to see these fingers. Then only you should ask the patient how many fingers are there. If the patient says there are 2 fingers, then this quadrant is said to be normal. Next we go to the other quadrant where we show different number of fingers and ask him to tell how many fingers are there. the patient will say one finger, then this quadrant is also normal. Like that, this side up and this side down. We will do it. During the entire procedure, the examiner has to make sure the patient does not move his eyes in any direction while you are showing the fingers. That has to be monitored by the examiner's eye, and the examiner's eye also should see the fingers shown on all the 4 quadrants. Once we have finished testing one eye, we should go for the other eye. How to record this confrontation testing? For each eye, we should divide a circle into 4 quadrants, and we have to, if this quadrant the patient is able to count your fingers, we will make a tick. If this quadrant patient is not able to find your fingers, you make a into. If he is able to find here, you will make a tick. If he is able to find here, you will make a tick. So making a tick will say that quadrant is normal. Making a cross says that quadrant is abnormal or not functioning in the retina. So that way we record the confrontation testing for each eye. The same way for the projection of rays also, we record the response of the patient. In both the projection of rays testing and confrontation testing, which is done in all the 4 quadrants, how the functions of the retina or the visual pathway is estimated. That is what I want to explain here. If you want to show the fingers or the lights in each quadrant, that fingers or light will not fall on the same side of the retina. It will fall on the retina diagonally opposite to it. Suppose I am going to show my fingers here. This will fall on the retina on this side of the eye. So infratemporally I am going to show my fingers or light. It will fall on the retina, that is supranasally. So that retina is what we are going to test. It is a diagonally opposite retina that we are going to test in confrontation or projection of rays testing. This way it is carried out in all the 4 quadrants to see whether the retina is functioning in all quadrants or not, whether the visual pathway is intact everywhere or not. Now I want to tell one important thing for everyone. Whatever we are seeing outside, they are seen by our retina either upside down, or the right side is seen as left side is seen as right side. It is inverted and laterally reversed. That is how our retina sees. But our occipital cortex and our brain make them in right positions. That is, they put it vertically and they put it in right and left directions correctly, and we see the images properly. So whatever things that are falling in our eyes are falling inverted or laterally reversed. Let us see what are the things we can diagnose by doing this simple projection of rays testing and confrontation test, which is just a quantitative test and not a qualitative test. First we will see about the visual pathway lesions. The first thing is bitemporal hemianopia. The temporal sides for both the eyes are not seen. Only the things on the center are seen. So that is seen in optic chiasma, central portion lesion. That is, the nasal fibers are affected. Binasal hemianopia. So in the entire field, the center portion is not seen, only the outside will be seen on either side. That is called as binasal hemianopia. The nasal side is not seen. Anopia means not able to see. That is seen in optic chiasma, temporal side lesions. On either side of the optic chiasma there is a damage. The central fibers are normal. Next we see the left homonymous hemianopia. Left homonymous hemianopia means I am standing like this. My left side vision is not at all there. I can see only things that are on my right side. That is called as left homonymous hemianopia. If I am not able to see anything on this side, then my right optic tract is at fault. Right homonymous hemianopia. That is, right side I am not able to see anything, only left side I am able to see, then my left optic tract is at fault. Next we come to the right superior quadrantanopia. On the right side, superior aspect I am not able to see. With both the eyes I am not able to see anything here. Then there is some problem diagonally opposite here in my brain. So this portion is the temporal lobe of the brain. So left-sided temporal lobe problems will lead to right-sided superior quadrantanopia. Right-sided temporal problem will lead to left-sided superior quadrantanopia. So you will not be seeing anything on this portion. Similarly, if there is a right-sided inferior quadrantanopia, that is on my right side, this below portion I am not able to see, means diagonally opposite parietal lobe is at fault. My left parietal lobe is at fault, that's why I am not able to see this side. If I am not able to see anything on the inferior aspect on my left side, that is left inferior quadrantanopia, my right parietal lobe is at fault. This is how we are able to diagnose the visual pathway lesions by doing these simple tests. Apart from the visual pathway lesions, we can diagnose with this projection of rays and confrontation quantitative test. We can also diagnose lesions in the retina. What are the lesions we can diagnose in the retina? We can diagnose branch retinal artery occlusions. Suppose the supratemporal artery is occluded, then this portion of the retina will not be functioning. So on the field, this portion will not be seen. So if this portion is affected, this portion will not be seen. If the infratemporal artery is affected or blocked, then this retina will not function. So opposite side, the upper portion will not be seen. Similarly, for the nasal branches, upper nasal branch is occluded, then this retina will not function. So you cannot see on this side. If it is occluded here, you cannot see on that side. That way we can diagnose branch retinal artery occlusions. We can also diagnose retinal detachment in each of the quadrants. If there is a retinal detachment in this portion, if you show light from here, it will not be seen. So this portion will not be seen. Like that, retinal detachment can also be diagnosed in all quadrants. With this, I will stop about this field testing. Field testing, we have to read and understand in a proper way. If you do that, you can diagnose so many conditions easily by doing the simple projection of rays testing and confrontation testing, quantitative as well as qualitative. Qualitative test I have not done here. I am not also talking about the perimetry tests here. If everything is done, we can diagnose many things. Automated perimetry testing is done to diagnose this glaucoma field defects. So that will give accurate glaucoma field defects assessment. With this I will stop here. Thank you. We will see in another video soon.